In the United States, only 41% of fourth graders met proficiency benchmarks in math, and 35% met those benchmarks in reading. For eighth graders, the numbers are even lower. Once children fall behind, it's difficult for them to catch up. This is especially true for students from low-income families, who are more likely to begin school further behind their peers.
The issue here is that just everyone is different, and that's especially for students who learn at different speeds, arrive at the fall with different abilities and skills, and that makes it really hard to teach in a class of 25 different students in the same way.
COVID-19 has exacerbated these challenges through inconsistent learning environments, low attendance, and inequitable access to education technologies and resources. At JPAL, meta-analysis of results from 96 randomized evaluations found that tutoring programs can help improve academic outcomes up to the equivalent of an additional half year of school.
A meta-analysis is an exploration of whether patterns of conclusions exist from looking at not one study, but a collection of studies, finding that tutoring programs consistently led to significant and large improvements in learning outcomes for students. So about 80 of the 100 studies found meaningful effects where the average of those effects were really large in terms of overall improvements towards test scores.
These programs can be especially valuable when tutors are paid professionals and tutoring services are offered during the school day. Informed by this rigorous evidence, the Biden-Harris administration, the U.S. Department of Education, and multiple states are turning to tutoring as a promising avenue to combat learning loss among students.
One of the whole points of this kind of collection of evidence is to show reassuringly that we have consistent results that can be confidently extrapolated in making recommendations that are likely to hold when looking at the future programs. And the kind of findings that we have, the consistency is quite rare in social science. I think that the tutoring effectiveness that we have found is some of the most consistent evidence of any program being effective in education policy compared to any other program that we might want to consider.
In 2020, JPAL North America staff met with the California Governor's Office to understand the state's educational challenges and discuss how rigorous evidence on the effectiveness of tutoring can inform policy responses. As a result of these conversations, the California legislature allocated $460 million for paraprofessional tutors in their 2021 school reopening bill. Over 6 million students in California's public school system will benefit from this decision. JPAL North America continues to work with California leaders to ensure tutoring funds support evidence-informed approaches. In July 2022, the Biden-Harris administration called on schools across the country to expand student support services, including high-quality tutoring programs, using funds from the American Rescue Plan. The press statement cites the 2020 meta-analysis as evidence on tutoring's effectiveness. As part of this effort, the new National Partnership for Student Success will provide resources, including JPAL North America's tutoring evidence review, to organizations and schools that want to administer academic tutoring. JPAL North America is now funding research that will examine the impact of computer-assisted learning on student outcomes in Puerto Rico, Texas, and Toronto.
So computer-assisted learning, such as a program like Khan Academy, allows students to use a computer to be exposed to different questions, to progress at their own pace, to receive immediate feedback, to get help when they're stuck, and to have that data feed back to someone like a teacher who can then use it to try to customize the learning trajectory or roadmap that a student might follow.
Through this research, JPAL North America seeks to gain a deeper understanding of how education technology can help tutoring improve learning for an even greater number of children.